Awesome. Well, welcome to the Nurse Leader Lounge. In this episode, I am really excited to introduce my friend, previous coach, and ongoing business, uh, I guess, mentor in many ways for a lot of different things, Michelle Greene Rhodes. I'm excited to have you today.
Hi, Dr. Amy. Thank you for having me. I appreciate the invite.
Absolutely. Well, I thought we'd kick off with just talking a little bit about color of wellness. And, this has come so far. When we originally met, it was around you were mentoring and coaching me through writing a book and sort of putting together my thoughts and structuring, speaking and programs and things like that. And of
Mhm,
course, along the last few years since we started that process, gosh, that was in 2020. So it's been a couple of years now.
mhm, mhm. Yep, right.
Your business especially has really grown so that you're really entering how do I help with health literacy, getting resources to the community that I serve, and then of course empowering Black nurses, which has really been such an amazing platform to watch. So I thought I'd let you start out by introducing yourself and sharing a little bit about your color of wellness.
All right. Well, thank you again. I appreciate your invite and thank you for your time. This is awesome. I'm proud of you, of course. All the things you're doing to pour back into us nurses, keep us astute in our leadership skills, and it's so needed, right?
Right. Huge.
It seems like the world is changing right before our eyes, so I feel like I need to stay connected to some iron that's gonna keep me sharp.
That's right.
But yeah, we actually started our brand. It's the Color Wellness Media. So we're the first Black wellness media platform by Black nurses. So it does encompass quite a few things, but to put it succinctly, our goal is to help increase health equity through health education. But we wanted to be that trusted source, that face, that relativity, and very laid back type of media outlet. We didn't want the scholarly feel. We wanted a lifestyle feel where it felt like your cousin or aunt was having a conversation with you and saying, hey, or a nurse that you know in the neighborhood. Have you
Yeah.
thought about this? Have you considered that? Have you talked to your doctor about that? So that's the feel of the magazine. Through that, because it's structured that way, the health literacy piece is still new for us. We're still building out some programming. However, it's always been for it to be around a 10th grade level of education, the way it reads, and so that hopefully help those who may struggle with reading or retaining or remembering what they've read. They can take what we read and kind of understand it very easily. Or again, the goal is always to have them take our magazine to the doctor with them. That's always been the goal. So yeah, we wanted to do our part in the health equity fight. We know it's a huge fight, but for me, it was what I could do because my background with before the color wellness, as you mentioned, I was coaching and pivoted through the pandemic
Mhm.
because I wanted to help the Black community a little bit more. I was like, what can I do to help? This is just the
Yeah.
numbers that we saw and the data throughout the pandemic was just astounding. So through my writing skills, communication, which was a strong point for me, that's why we started with the magazine. And so we've grown from there.
Well, I think it's interesting even to go back a little further so people know your background is in case management. And so you really have seen for many years the access, the equity, the outcomes. And of course, as people then go back into their communities after a hospital visit, et cetera, seeing how their care is managed and, the impacts it has on them. And I think that is such a critical point because I know I've seen it through the years too of just helping people ask the right questions, when they go see their provider, right? And how do we help them to understand a little more about their disease so that they can even have that conversation? Because,
Absolutely.
yeah, that could be
Because
such
you
a good.
don't know what you don't know, right?
That's right. That's right.
Hmm.
And
And
if your parents
sometimes,
never talk to you about it, and yeah,
absolutely. And sometimes it's too late, which was
right.
really what I saw as a case manager, disease management
Mhm.
nurse. And then my last position was population health, which I really got to see the
Right.
broader aspect of it regarding populations and geography. And that's when my eyes were open to see
Right.
this percentage who
Mhm.
took advantage of mammography or took advantage of certain screenings or was really, really bad. It was really, really bad. Or if they did get those screenings,
Mhm.
stage 4, end stage.
Yeah.
And so it just was like, okay. What can I do?
Right. Yeah, because most people, especially in some of our rural communities where access isn't easy, I don't go until I feel bad. And sometimes feel bad has been so progressive that I don't realize how bad it is until I go and as you said, now my disease is down the road, where if we'd caught it much earlier, maybe it would have been more preventable or even able to minimize those symptoms. Yeah. Well, that's huge. It's such a big thing. One of the really neat things I've been seeing you do over the last few months is coming out with more around, empowering us as healthcare workers to be able to talk well and communicate well with those so that they feel included and they feel welcome and able to open up to that provider or to their caregiver, their nurse, etc. So you want to talk a little bit about some of the work that you're now so you've grown your platform with Color of Wellness, and now you're moving into how do I help others ensure they can communicate well with this population? What are some of the things you're starting to do?
Yes, yes. Thank you for this. I get excited because I
Yes.
had to step back and take a look, like where are we headed with this? Where are we going with this platform? Right. It was nice to have magazines, but what impact are you making? So as I began to dig into that, I ended up looking at the whole spectrum of where color wellness fit in on the prevention spectrum. If I were a, again, average patient coming into my doctor's office, where would that come in at? When would I even learn about the color wellness? Or if I was being discharged from the hospital, what was my typical client going to see and hear and feel? So that's when I began to see, gosh, color wellness is really the entry point
Mhm.
for someone just learning about what we do. But there's so much more that comes after that. But you know what? There's something that needs to happen before they need to even learn about color wellness. Because if we're just here, creating, the magazine, the podcast, the videos, first of all, there's two pieces to that. We need nurses and other healthcare providers to know that we're a resource.
Mhm.
So how do we let them know that we're here? How do we let them know that we're available to, share these resources? So that was the first thing I had to tackle. So I know I needed to get connected to either more PCPs or more hospitals. But once we connect, what is I mean, they're just going to tell us about a magazine. What does that look like?
Yes.
And so that's when I decided, you know what, we need to include my peers because they play a part in this. They may not realize it, but before they can even say, hey, think about this resource, there's a whole hospital stay this patient has just completed. How would they treat it? Are they going to come back? Are they going to recommend this hospital? Are they going to speak positively of the nurses? Are they going to speak negatively? What was their experience? What was the safety? You know what I mean? So I just saw that piece was missing. And I said, in order for even, my counterparts or my peers or my profession to speak well of us, they have to speak well to the patients, and likewise the patients feeling in that rapport, that comfort, inclusion. And so it really boiled down to an inclusive communication piece where we go above and beyond. We're surpassing the standards. So
Right.
now it's easy to say, and hey, you might want to take a look at this type of resource to keep you, here, or so things progress, or talk to your doctor about this resource. And then we have some other things that come after that, not just the magazine. The magazine again is the entry point, but there's hopefully a coaching and support group that comes after that. So that's
Mhm.
the next piece that we'll be working on, so they can refer them, hey, 12 weeks, at least work on your healthy habits, because we're a preventive program. So we're
Right.
not, end stage disease management, case management. So it's like healthy habits. How do we just get habits for Black families ingrained? And so that's where the programming piece will come in. And then we can show the impact at the end. But there's a whole spectrum of things that needed to happen to really get this where it needs to be. So hopefully that helps, people see what we do. And so inclusion was a big piece of this transformation to me. I kind of opened it up a little bit more to include others so that healthcare could see there's a different type of resource available. Yes, we have health education here, but we're a little bit different, powered by nurses, specifically Black nurses. And we have the desire, that relativity, the desire, that piece, that missing piece, I feel like that
Mhm.
is there, that can help really bring in those patients, make them feel connected to your brand. We're here to support your brand as the hospital. And then they go out and speak well of you. So it's a win-win for everybody. So I hope that helps.
Yeah, yeah. I think it's interesting. I've had over the last gosh, just the last 3, 4 months, I've had multiple friends or family members going through the system. And it's been a learning experience to see it from the other side because it's been a little while, honestly, since I've seen it from the patient side, thankfully, thank God. But, having recently seen it with a couple of friends and currently with a family member, it's really interesting how much difference some of the small stuff makes. Things like just pausing for a minute and how you connect with the patient, and I think even things like bedside report, nurses,
Absolutely.
we've been trying to hardwire a bedside report for what, 15 years now, and nurses still fight it. And I will tell you that the people that I think are great from a patient standpoint are the ones who do this stuff well, that it's just part of their routine. They don't even think about it anymore. They come in, they do a basic, it wasn't anything huge or extensive. It was just, hey, da 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 da, and hey, do you have any questions today? So the plan is, we're waiting on a CT scan, or they're waiting to hear back from so and so. Is there anything else you're worried about today? Okay,
Mm,
have that conversation that included that patient and family member. I was blown away, quite frankly. I was like, that was so pristine right now. I
yes,
wish I had
yes.
my video camera out. And then it happened again and again and again. And that makes a difference because now
Huge.
trust, we have that inclusion. So not only is it inclusive from a ethnic perspective, but just from a patient and
Right.
caregiver perspective, right? So now I'm more likely to say, well, I'm really scared. I'm struggling with my pain control and I'm afraid to ask for more because I don't want to be perceived as, how do we do? Or I'm scared to do XYZ. And if we don't have those conversations, we don't build that trust, we're
Absolutely.
not able to make those connections.
Absolutely. Absolutely. It's so important. And I'm so glad you mentioned just an example of what it could look like. And
Yeah,
sometimes we don't even think about some of these things until we're in the hospital. And then
right.
those who are not in healthcare, they have even harder time because they don't know what they don't know. They don't know what to ask. Sometimes they
Right.
can't remember, but they don't
Yes.
remember most of the things that we're asking.
Yeah.
So some of the things that we've created and put into our program is, not yes, for patient relativity, but yes, we do put a little bit of the culture in there. So we have questions that we put into the assessment that the nurse can ask. It's very optional, but at least they know what types of questions that they could
Right.
add to their assessment, right? So let me ask a few of these questions about culture. Let me ask a few of these questions about spirituality. You
Yes.
wouldn't believe how big of a part that plays in a patient's belief system, right? Because a lot of
Absolutely.
this that they say yes or no to or understand or will take in, it's because of their belief system. So if we tackle, believe, we put a little bit of mindset in there. We talk about history, which I know is always a concern because some people again can draw really well from their history and some can't.
Right.
And then we go, yeah, into more of the cultural piece. So it's a little bit more in depth than your general assessment, but giving them a pool of questions that they can ask based on the situation. That gives them a little bit more information to give better care. Right? This is what it's all
Right.
about.
Yeah.
Yeah, absolutely. So that's just an example of how we support what they do, but also, which is really huge, and we've gotten this request from the nurse side, like of course training the nurses just speak more inclusively, ask those questions. But I mentioned to you before the show that even leaders are wanting to get more information on how can they be more
Yes.
inclusive in what they do. So we're looking at how we can support leaders. And then also for all of them,
Mhm.
we do as part of our train the trainer implicit bias assessments. So everyone leaves with that knowledge as well, because sometimes again, as the caregiver, we don't know what we don't know, or we have some things that we
Don't
don't want to
realize
talk
it
about,
themselves.
things that
Yeah.
ways
Yeah.
that we believe or
Right.
perceive people,
Mhm.
biases, stereotypes, all of that. But how does that affect the care that we're giving as a nurse? I want to make sure I'm getting the best care without you withholding from me. And studies have shown this. This is why I'm so excited about this program. I've pulled the studies where, same exact diagnosis, Black patients got poor care because they were not offered certain things in certain situations where
Mhm.
a white person got all of that they needed and had a much better outcome. I mean, there's so many studies that I pulled regarding that. So, and then lastly, when it comes to that, like worst case scenario, we've seen horror stories about, racism and things that happen in the hospitals with patients that they didn't either get the care they felt they needed, or there was some sort of discriminatory practice that occurred. That's where the big dollars come in. We want to avoid that type of cost that can really be a detriment to the hospital.
Right, right, absolutely. And, a detriment all around because now where do I go? Where do I get care? I don't trust anyone. And yeah, that's just such a devastating relationship or lack thereof, that people will have, and it's been interesting as I've talked with certain patients and said, well, why didn't you do this? Or what kept you from doing that? And it usually comes back to some relationship that they had, some interaction that they had with somebody where they felt unwelcome or stupid
Mm,
or, something else. And again, race aside, it was just that interaction. So now, because of this interaction, I no longer have trust. So I'm going to have a lot of questioning. Well, then the new provider comes in and says, oh, this person's hostile, or this
ah,
person, without understanding their background and maybe why they're reacting that way.
absolutely.
So it just creates this ongoing pattern, yeah, where we're not meeting the needs. And
Mm,
it's really, when you remove yourself from the emotion of it, it's quite fascinating to study and to think, okay, how can we prevent that from having occurred right there,
absolutely.
that right there, and very interesting approach
Mm,
to have to take. And I remember I had a patient one time. I use this example a lot because it's such a unique and I think clean example, if you will, of a specific cultural difference. And I had a patient who was Korean. I was the nurse manager at the time of a postpartum unit. And my nurses came to me very frustrated because the patient wasn't engaging with them, wasn't talking to them a whole lot, was starting to run a fever. They couldn't get her to drink water. They couldn't get her to shower. The auntie and the grandma were in the room doing everything for the baby, and we can't get them out of the way. And I said, well, hang on, let's go to our resources and let's look up what their specific background needs and beliefs are. And the beliefs were that you don't bathe for the first couple of weeks. So I said, well, how about let's focus on peri-care and hand washing? And she was supposed to just breastfeed and rest. And
mm,
mommy and auntie were supposed to do everything for her. So instead of saying she has to learn all of this, well, clearly they're going to be providing the care for the next couple of weeks. Teach them the cord care, teach them what to look for with the baby. So instead of forcing them to have our perspective to it, how do we go to their perspective? And, we were giving her ice water and she was in a hot state. She wasn't going to drink it. So you have to give them lukewarm or, warm fluids. And then once we got her drinking and once we got that engaged and we reset our expectations to that
mhm.
care, now we had a successful delivery and discharge. But until
That's
we reset our approach,
right.
to meet their needs versus expecting them to adjust to ours, our expectations. We
Mhm.
had a huge disconnect that could have actually been quite damaging
Oh,
to that
wow.
patient family,
Absolutely.
you know?
That's
So I
good.
think it's the same thing when you're thinking about, sometimes we don't think about, black versus white, but I remember as a labor and delivery nurse, a patient telling me, I can't put my hands over my head. Stop asking me to do this or that. And I said, well, tell me why
Awesome.
not? She said, well, the court will give them not. I said,
Mm,
tell me why you believe that, and that was a cultural belief in the community.
yeah.
So of course I start asking my other friends. I'm like, hey, is this a belief?
Definitely.
Yeah, I heard that for years. My grandma told me that. And I'm like, wow, I never thought. And here I am trying to get her to change her clothes. And I'm like, okay, we can find a different way to do this because for you,
Yes, yes.
feel fear, you know?
So good.
Yeah. So we've got to have a way to approach with understanding or
Hmm.
hoping to understand.
Yes, yes. And that's what it's all about. So, I mean, those are wonderful examples, but took the time to ask why and tell me more, as opposed to why. It's more like, share with me. I'd love to hear more. I'd love to learn more. Can you tell me more? So those types of questions. I didn't mean to say why, y'all.
Yeah.
That's kind of a one that makes you kind of cringe. So
Yes.
my worst case
Yes.
scenario, you can ask why, but it's like, share more with me. Do you mind sharing that with me? I'd love to learn more about where you're coming from.
Yeah.
And that's, yeah, one of the five, what we call our five parts of communication. So it is, the inquisitive piece. We have to, in order to get good answers, we need good questions. So
Right.
totally important piece. I was just thinking, let me know how I'm doing on time. Am I okay?
We're good. Yeah.
I didn't know about how a little bit about how this started as well. You mentioned case management, and we briefly talked about this before the show. But again, one of the reasons this is so important for us to create programming to help with this, because we've seen data. Data is always right, the driver. Research is a driver. We want evidence-based information. And so when I started to dig into this, I'm thinking, wow, I didn't realize how many, for instance, we were called in to do support with a mammography campaign
Mhm.
where mammography was totally free with this particular campaign for a hospital. But for some reason, Spanish women came out in droves with Black women who were not showing up.
Yeah.
And the hospital was very concerned about, this is free. What are we missing? Why the low attendance? And money sitting there to pay for these tests. Uh, and so it's just an example of communication. How do we, probably the next step is go over, overcome social determinants. So transportation was a big thing. I'll
Right.
tell you the kind of result of that, but transportation, we know that's a determinant. It was a
Right.
big concern. And then those who work hours in daycare, um, that's a concern. So making sure they put in some after hours and some weekend hours, that kind of helped as well. But Color Wellness was able to kind of be a bridge to communicate the importance of it. And this, again, it goes back to belief, because a lot of the women felt like, I don't need it. It doesn't run in my family. Those things hurt. I don't have time. I'm okay. I feel fine. I check it myself. Although
Right.
that's important, we still need to get screened. So this is an example of why we do what we do, is let us be a bridge to help push that message forward.
Right. Right. Yeah, I think that's huge because, we're finally getting to the point where social determinants of health are being included in assessments. When I admit you, tell me what those factors are going to be that prohibit you from being successful with a follow-up visit after discharge or obtaining your medications or
Yes, yes.
like you said, whatever it may be. So I think that's huge that people are finally going, oh, well, can they get to it? Oh, okay. Well, if they can't get to it, is this, I can't do that via telehealth. So what can we do? So I think those are huge, huge pieces that,
Yes.
we've got to step back and take a look at. That's great
Mhm.
points. Yeah.
Yeah, absolutely.
So
Very important.
yeah. So what were the two things you would tell, the leaders that are listening to the podcast? What are two pieces of advice you'd give or resources maybe you'd like to direct people to?
Well, as far as giving, the first piece, and this comes from an assessment I just did last week, matter of fact. Um, Although we are inclusive communication, we do subcontract diversity work through our company. Well, the concern was that this CNO at come from a well-rounded type of facility, lots of cultural programming, very accepting in the culture, so to speak, trained with a leader in diversity, and the promotion that she received took her to another city that was quite the opposite,
Right.
where culture was very stagnant, not open to diversity training. She tried to do all this on her own. It was a small hospital,
Yeah.
and began to receive threats.
Mm.
So the culture, at my point on this, is to think about the culture, because I think she came to us kind of afraid and not knowing how to move forward. And my advice, though this comes to the tip, was really this is a cultural transformation of your facility. I can't even, to me, come in and just do a training.
Right.
To me, it takes time, as we know, process of change takes time. So from what I see, now we haven't assessed the organization, but you probably are a very, very early process of change. So our education needs to be at that level. I don't want to come in at the point where they're ready to receive training when they're not ready to receive training, right? So I guess the tip here I'm saying is think about where your culture is in that process of change, or if it's change management, are they ready to start the process to learn? Are they even open? Or do we need to even do some education before the actual training takes place to prepare the culture to receive new information? And don't be afraid to do that. I think that was the concern, and not realizing that there were some things we can do before jumping in and sharing, all the DEI things and it not being received. We didn't want to repeat that. So
Right.
that's an example of how we can just prepare.
Mhm.
So set your organization and be prepared to maybe do some things before the real thing takes place. And so as a result of that, at the event I mentioned earlier, we're going to be doing a private podcast just for the leadership so they can listen in, learn some of these tools before we even come in and do training. So I think that's one thing I would say just for leaders is to assess the org and see where your culture is in regards to the process of change.
Mhm. Yeah, I think that's really key because if you think back to John Cotter's theory of change, you've got to create that shared vision. You've got to create that sense of urgency that's part of, yeah, we need to do this. And if we're not in a place of we need to do this yet, you can put in as many classes and courses and checklists as you want, and then wonder why yet another initiative failed because we
Exactly.
didn't start at the beginning to say, where are we at? Who are my stakeholders? Where are they at? What do we need to
Exactly.
do to get everyone on the same page and then go through that process? I think that's a great point.
Yeah, absolutely.
Yeah.
So and there are resources there to support that change. So I think that was the thing, is that she just didn't have either the resources or support to help make that happen. So we're happy to support her. And then
Yeah.
there was a second part to that question. You
Yeah.
said
Do you have any
to
other resources that you would recommend people go look at if they're thinking about implementing something or looking at?
yeah, I lately I'm really into the commission where, and I don't know if you might have known about this and what you do, Amy, where the health equity piece that they are really promoting.
The
They
Joint
even have a
Commission?
certification now. You seen it?
No, I haven't yet, actually. Yeah.
Yeah, they have a health equity there's new standards to health equity, but it includes, different things that the facilities can implement, having one key person, having trainings, all of that. But in addition to that, they offer their own certification. So just digging into what that looks like and then being able to prepare our agency to help you all get prepared for that certification. So
Right.
just
Right.
just a resource that you can go look at the new standards and
Mhm.
see what that looks like to either get prepared, where we help you all get ready, or if you're ready to jump right in and get your certification from the commission so that you stand out as a leader.
Right, right. Excellent. Yeah, that'll be huge, especially as, you know, places really do try to buy into those centers of excellence that the Joint Commission does and pull that together because that's really one of those pieces that they can stamp on the website in the front of the hospital and say, hey, you want to come to us because we're committed to doing this. We've been through this process and
Mhm.
we're committed to that excellence. So yeah, that's
Yeah,
awesome.
and it's strictly health equity. I don't know if I said, did I say that?
I
That's what
believe
the,
so. Yeah,
okay. Yeah, that's what the certification is for, is to say
right.
you're, fully
Yeah.
embracing health equity and equitable care. So I just
Excellent.
personally love it.
Right.
Let's
Well, that's
start to systemic change.
right.
Mhm.
Completely. Yeah. Because that's got to be more than just, we did a few things and we gave a few classes. That's, we have policies, we have processes, we have, backup plans, and we have training.
Absolutely.
Yeah. Yeah.
Absolutely.
There's a
So
lot
that's where we come to,
for
to
sure.
help you with that. Absolutely.
For sure.
So
Yeah.
we're
Well,
excited.
a couple of fun questions as we end the day then. What is a book that you're reading right now that you wish everyone would read?
Oh my goodness.
Special or fun? I
This is
know.
probably not fun, but it's been life changing.
Yeah.
And I know it's what cliche, but I have really been digging into my Bible work. I don't know if you've noticed,
Yes.
but I have just had to slow down with this new shifting in my life, and I wanted it to be led by the spirit. I wanted to be just in a good place and not just all Michelle in my brain. No, what's bigger than Michelle? Because this idea was not Michelle, it was bigger than Michelle. So just really tapping into my spiritual wellness has really been like life changing for me. I thought I was spiritual before, but I really like, and maybe it's because I've also been working on my mental wellness. So both together,
Mhm.
and it just feels like the world is mine. So
Wow. Yeah.
stay, watch out, world.
Right.
It's bigger than Michelle, but feeling like I can like conquer the world right now. So that really has been where I'm focused my reading.
Yeah. Yeah. And, which leads me to probably the other great question I had. What is your biggest piece of wellness advice you're giving people right now? You know,
Yeah.
just how to
Yeah.
improve.
And of course, we know spiritual wellness is just knowing that something is bigger than you. So it's not just Christianity, but whatever that faith is, because I can, like I said, combine that with my mental wellness and also meditation and journaling. I have been like really super intentional, and this is every day.
Yeah.
I would say if you just commit to either one or two of these for a good, they say 21 days to create a habit. And that's what happened with me. At first, it was just
Yeah.
let me up my game. But then once 21 days hit, I was like a new person. So I would say get serious about it and challenge yourself to 21 days, and you'll be in a whole nother level of leadership from the inside out.
Yeah. You know, so many of us don't concentrate on the self-care. We concentrate on a skill or another thing or a certification or the next, we don't really think about I can level up also by just making sure I am well, I am ready, and I am whole, you know?
Absolutely. Yep, that was me. And you probably know that I was so busy ripping and running. And so I do hope that someone out there is hearing this, because I was that leader, entrepreneurial leader, but it was about the checklist and getting all the things done and the deadlines and the milestones. But it wasn't until I did the whole opposite that everything
Right.
changed and improved. So
Yeah,
I do think that it's important for us to take that time to slow down, and it has really changed my life. So
that's awesome. Well, I love
yeah.
it. Well, as always, it's great talking with you and catching up. So we're going to have some resources in the show notes. There's a resource website from the HRSA, as well as Color of Wellness that you guys will be able to get to and have some references, and reach out to Michelle and the team, or see the magazine as well and access the podcast. So great to talk with you, Michelle. Thank you so much for your time today.
Thank you so much, Dr. Amy. I appreciate it.